Hi, my dear students. Have a nice day. And today, the topic we are going to discuss is perineal membrane. Today's topic is actually the perineal membrane, but I like to go through the urogenital region once more to revise you again, which I covered some aspects when I took the perineal pouches. So first, again, listen, what is urogenital region? It is the anterior division of the perineum. Anterior division of the perineum, that is known as the urogenital region, which contain the urogenital structures. And this urogenital region also contain the superficial and deep perineal pouches. When you move on to the cutaneous innervation of the urogenital region, you are coming across the first one, that is the dorsal nerve of penis, which is supplying the skin of the penis or clitoris except at its root. So this dorsal nerve of penis, the perineal nerve, inferior rectal nerve, these are the branches of pudendal nerve. So the two terminal branches of the pudendal nerve includes the smaller terminal branch is this dorsal nerve of the penis or clitoris, and the largest terminal branch of the pudendal nerve is perineal nerve. So the dorsal nerve of the penis or clitoris is supplying the skin of penis or clitoris except at root. The root of the penis is supplied by means of ilioinguinal nerve or genital branch of genitofemoral nerve. So, these two nerves, it supply the skin of anterior 1/3 of the scrotum or labium majus and the root of the penis. The next one is perineal branch of posterior cutaneous nerve of the thigh. The term posterior is there. So it is going to supply the lateral part of the posterior 2/3 of the scrotum and also the lateral part of your urogenital region. The next is the posterior scrotal or labial nerve. This is a branch of perineal nerve. This in turn is a branch of pudendal nerve. So posterior scrotal or labial nerve, they are the branches of perineal nerve, and perineal nerve is the largest terminal branch of the pudendal nerve. So it is going to supply, again the posterior term is there. So it is going to supply the medial part of the posterior 2/3 of the scrotum or labium majus, and it is also going to supply the medial part of the urogenital region including the labium minus in female. Then the mucous membrane of urethra is there. It is supplied by the perineal branch of the pudendal nerve. So this is the cutaneous innervation of the urogenital region. Come to the superficial fascia of urogenital region. So it is made up of two layers as in the lower part of the anterior abdominal wall. That is superficial fatty layer and deep membranous layer, that is known as Colles fascia. The superficial fatty layer, it continues with the superficial fascia of the surrounding regions. And the main component, it forms the superficial fatty layer. It forms the major part of the mons pubis and the labium majus in the case of female. The next one is deep membranous layer, that is known as Colles fascia. It is attached posteriorly to the posterior border of perineal membrane. So this layer do not extend into the anal triangle. And on each side It reaches up to the pubic arch, on each side to the pubic arch, below the crus of penis. So there is a small gap for the crus of penis. Below that, it extends on each side to the pubic arch. Then anteriorly, this layer is continuous with the fascia of the scrotum, which containing the dartos muscle, and it also continues with the fascia of the penis, that is known as Buck's fascia, and it also continues with the membranous layer of the anterior abdominal wall or fascia of Scarpa or Scarpa's fascia. So we know the superficial fascia of this perineum or the perineal fascia have two layers, that is the superficial fatty layer and the deep membranous layer, that is also called as Colles fascia. So superficial fatty layer, it contains fat, and that is mainly forming the main substance of mons pubis and labium majus in the case of females. And one more thing you have to remember is Colles fascia is not extending to the anal triangle because its posterior border, it is fused. This Colles fascia is attached to that of the posterior border of perineal membrane. So it is not extending into the anal triangle. Then, after the superficial fascia, then you have the deep fascia of the urogenital region. So the deep fascia of the urogenital region is again made up of two layers, which lines the urogenital diaphragm superiorly and inferiorly. So accordingly, we can give it name as superior fascia of the urogenital diaphragm, which lines superior to the urogenital diaphragm. Then the inferior fascia of the urogenital diaphragm that lies on the inferior surface, and this inferior fascia of urogenital diaphragm is also known as perineal membrane. So like the superficial fascia, the deep fascia also have two layers, that is the superior layer or superior fascia of urogenital diaphragm and inferior layer or inferior fascia of urogenital diaphragm. So we see about the layers of superficial fascia. So that is superficial fatty layer, and there is deep membranous layer, and this deep membranous layer is known as Colles fascia. The next we are moving to the deep fascia. So deep fascia of the perineum. So perineal fascia have the superficial layer and deep layer. Like the superficial layer, the deep layer also have two layers. It is also made up of two layers, and it lines this urogenital diaphragm superiorly and inferiorly. And the superior fascia of the urogenital diaphragm, it is thin and it is less defined than the inferior fascia. It is coextensive with the perineal membrane, to which it is attached anteriorly and posteriorly. Laterally, the superior fascia is continuous with the obturator fascia. So where will you see the obturator fascia? It is the fascia that is lining the interior aspect of the obturator internus muscle that you see when you study the pelvic diaphragm. So in this obturator internus, that is the muscle you can see it is pulling the obturator foramen. So internal to that there is a fascia that is called the obturator fascia. So the superior fascia, it is ill-defined fascia, it is very thin and it is attached anterior and posteriorly to the perineal membrane, and then laterally this is continuous with the obturator fascia. It is pierced by the urethra and also it is continuous with that of the fascia of the prostate, that is the prostatic fascia. So that is the fate of the superior fascia of the urogenital diaphragm. So now you know that the deep fascia is lining a diaphragm, that is the urogenital diaphragm, superiorly and inferiorly. So what is this urogenital diaphragm? So you can see a triangular musculofacial diaphragm which is located in the anterior part of the perineum. And this anterior part of the perineum is urogenital triangle. So a musculofacial diaphragm that is seen in the anterior part of the perineum, that is known as urogenital diaphragm. So it fills in the gap between the pubic arch. It is composed of two muscles, that is sphincter urethrae and deep transverse perineal muscle, and this is enclosed within the two layers of deep fascia, that is it is enclosed within the superior and the inferior layers of fascia of urogenital diaphragm. And this inferior layer of this fascia is known as the perineal membrane. So, urogenital diaphragm is a triangular musculofacial diaphragm which is located in the anterior part of the perineum. It fills the gap between the pubic arch, composed of sphincter urethrae and deep transverse perineal muscle, which is enclosed within the superior and the inferior layers of fascia of urogenital diaphragm, and this inferior layer of the fascia is called as the perineal membrane, or it is formed by the perineal membrane. So now we are moving to the core topic of today, that is the perineal membrane. So what is now the perineal membrane? It is the inferior fascia of urogenital diaphragm. So the fascia that lines the inferior aspect of urogenital diaphragm, or the deep fascia which lines inferior aspect of urogenital diaphragm, is called as perineal membrane. In this diagram, you can see the perineal membrane, that is the inferior membrane, and above the superficial superior fascia of urogenital diaphragm, and between these two layers, in the case of female, that is a pouch in the case of male and female, between the superior fascia and the inferior fascia, that is the deep perineal pouch. And you can see the two muscles there, that is the sphincter urethrae, that is the external urethral sphincter, opening of urethra, and other muscles, deep transverse perineal muscles can be seen. In the case of female, the opening of vagina can be seen. So this is the urogenital diaphragm. You can see the two muscles sandwiched between the superior and the inferior fascia of urogenital diaphragm, and that is a deep fascia, and this inferior fascia of urogenital diaphragm is known as the perineal membrane. So perineal membrane is very thick. It is thick triangular sheet of fascia that lies across the pubic arch, and its posteriorly it is connected, the posterior border or base, it is continuous with that, with the superior fascia of urogenital diaphragm, and in the midline this posterior border is connected to the perineal body. And what is this perineal body? It is a pyramidal fibromuscular node that is seen in the midpoint of the perineum, where 10 muscles are attached. So this perineal membrane in the midline, its posterior border is attached to the perineal body, and the posterior border of this perineal membrane is continuous with the superior fascia of the urogenital diaphragm. So perineal membrane is a thick triangular sheet of fascia which lies across the pubic arch. Then on each side, this membrane is attached to ischiopubic rami. And what is this ischiopubic rami? Your body of pubis have a body and one ramus, superior ramus. Like the ischium have a body and ramus. So the ramus of ischium and the pubis, they form conjoined ischiopubic rami. So this membrane is stretching across the pubic arch and also it is on each side that is attached to the ischiopubic rami. You know the boundaries of pelvic outlet and you know the boundaries of urogenital region. So anteriorly what you can see is body of pubis, the inferior aspect of body of pubis, there you can see the pubic arch. Then on either side, what you can see is ischiopubic rami, and posteriorly an imaginary line that is passing through the anterior aspect of ischial tuberosity. So that is the boundary of urogenital region. So this membrane is stretching on each side to the ischiopubic rami above the attachment of the crus of penis. Then the anterior border or apex, where is a triangular sheet. So for a triangle, there will be an apex and a base. So the anterior border or apex of this membrane is continuous with the superior fascia. And this anterior border is thickened to form a ligament that is known as transverse perineal ligament. Okay, that is the transverse perineal ligament. And around this pubic arch, there is a ligament that is arcuate pubic ligament. So there is an oval gap between this arcuate pubic ligament and the transverse perineal ligament. So it permits or transmits the deep dorsal vein of the penis to the prostatic plexus of veins, and also it transmits the dorsal nerves of penis to this organ, to the penis. So it transmits two structures. One is it transmits the deep dorsal vein of the penis to the prostatic plexus, as well as it enables the branch of the pudendal nerve, that is the dorsal nerve of the penis. So through this oval gap, this nerve can go and supply the penis. So that is about the attachment here. So you can see now it is a thick triangular sheet of membrane or triangular sheet of fascia which lie across the pubic arch. It is stretching across the ischiopubic rami above the attachment of the crus of penis. Then this anterior border or the apex is continuous with the superior fascia. It thickened to form a ligament, that is transverse perineal ligaments. So between the arcuate pubic ligament and the transverse perineal ligament, there is an oval gap which transmits the deep dorsal vein of the penis to drain to the prostatic plexus of veins and the dorsal nerve of penis to supply this organ. So the structures piercing the perineal membrane. First we consider the male. The thing that is seen in the midline, the single structure, that is single urethra. One urethra is there. That is in the midline and it is 2.5 centimeter below the pubic symphysis. Then the bilateral structures, that means two structures, two on each side. On either side of urethra, you can see there are ducts of bulbourethral gland. In this picture, you can see it. Then, a little lateral to the urethra, again artery and nerve to the bulb of penis. Then, Urethral artery, that is just in front of the artery to the bulb. That is the position of urethral artery. So a single urethra, on either side ducts of bulbourethral gland, then on side again artery and nerve to the bulb, and in just in front of this artery and nerve to the bulb there is a position of urethral artery. Dorsal artery of penis. It lies near the apex of the membrane. Then deep artery of the penis, which is seen at the anterior part of the lateral margin. It is behind the dorsal artery of penis. So dorsal and deep artery of the penis is piercing the perineal membrane. Then posterior scrotal nerves and vessels. They are seen near the piercing the perineal membrane near the posterior border. And there are branches of perineal nerve which pierces the perineal membrane to supply the superficial perineal muscles. Structures piercing the perineal membrane in females. Urethra, that is 2 cm posterior to the clitoris, and the vagina opening, that is just below and behind the urethra. This is unilateral structure. Then following are the bilateral structures. Artery and nerve to the bulb of vestibule. You can see. Then the dorsal artery of clitoris. Then deep artery of clitoris. Posterior labial arteries and nerves. The branches of perineal nerve to the superficial perineal muscle, that is muscular branches. So these are the structures piercing the perineal membrane of female, and that is similar that like that the artery and nerve to the bulb of vestibule, the same like that in the case of male, artery and nerve to the bulb of penis. Then there is a dorsal artery of clitoris in the case of female. The dorsal artery of penis can be seen in the case of male near the apex of the membrane. Then there is deep artery of the penis in the case of male. Here the deep artery of clitoris in the case of female, and that is seen at the anterior part of the lateral margin behind the dorsal artery. Like that along the posterior border there are posterior scrotal nerves and vessels in the case of male. Here you can see the posterior labial arteries and nerves nearing the posterior border of perineal membrane. And there are branches of perineal nerve to the superficial perineal muscles in the case of male as well as in the case of female. So these are the structures that is piercing the perineal membrane. In previous classes, we come across some of the structures, pouches, fascia. So this is actually the orientation of the structures in the urogenital triangle. So the structures that closing the urogenital triangle from below upward or superficial to deep. Okay, if you place in lithotomy, what do you mean by superficial is toward the skin, that is considered as superficial structures. Away from the skin is considered as deep structures. So first we will come across the skin. Then deep to the skin during the dissection what we will see is the superficial fascia, and this superficial fascia can be divided into 2 layers, that is the fatty layer, the superficial layer of fatty layer, and then there is membranous layer of superficial fascia that is known as Caude's fascia. So the superficial fascia or the fatty layer, it is continuous with the superficial fascia of the surrounding regions. The deep layer, that is the deep membranous layer of the superficial fascia, that is known as Colles fascia. It is attached to the posterior border of the perineal membrane. And on each side, this Colles fascia, it is extending to the pubic arch below the crus penis. Then anteriorly, this Colles fascia is continuous with the fascia of scrotum containing the dartos and the fascia of penis, that is Buck's fascia, and with the membranous layer of the superficial fascia of the anterior abdominal wall, that is known as Scarpa's fascia or fascia of Scarpa. So that is about the superficial fascia. So it has two layers, that is superficial fatty layer and deep membranous layer. And this deep membranous layer is known as Colles fascia. So it is anteriorly, it continues with the superficial fascia of the abdomen, the membranous layer of the superficial fascia of the abdomen, and also to the scrotum, fascia of scrotum containing the dartos muscle and the fascia of penis. Then the next one is contents of superficial perineal pouch. So it is the superficial perineal pouch is present, that is seen between this Colles fascia and the perineal membrane. So the next content is superficial perineal pouch and its contents. Then next, the structure what you are coming across is urogenital diaphragm. So urogenital diaphragm is composed of three components. One is the perineal membrane, the superficial structure. First seeing is the perineal membrane. So perineal membrane is the inferior fascia of urogenital diaphragm. Then you are seeing the contents of deep perineal pouch. As you already studied, what are the contents of deep perineal pouch? So it contains the muscle, it contains the bulbourethral gland in the case of males, and also the nerves and vessels related to it. So it contains the two muscles, that is the sphincter urethrae and deep transversus perineum. So that is the content, and then again deep to that, that is the superior fascia of urogenital diaphragm. So the structures that seen in the urogenital triangle from below upward or from superficial to deep, that is skin, then the fatty layer of superficial fascia, then the membranous layer of superficial fascia, and then there is contents of superficial perineal pouch, and then the urogenital diaphragm. So this is the orientation of the structures that is seen in the urogenital triangle. Thank you all.